now to your community focus. It's on the front page of this month's Rhode Island Medical Journal, the Young Adult Mental Health Crisis.
And joining us now to talk about the findings outlined, the guest editor of this month's edition, Dr. Sam Rosenthal with Johnson & Wales University. Thanks so much for being here.
Thanks so much for having me and letting me highlight such an important issue right now.
Yeah, so let's talk about, in 60 seconds or less, sort of what was the main finding? What's the headline here?
I mean, the headline is that the majority of our young adults 18 to 25 in our state are suffering from a mental health problem or diagnosis.
Wow. So I want to dive into a couple of different topics. First, maybe we can start with something that you looked at, social media use. We often talk about how social media can lead to depression, image problems in teenagers. What did you find when you looked at that area?
Yeah, I mean, I think the evidence is pretty conclusive at this point that social media is harmful to mental health, and that's been shown a lot for youth and teens, but it's very true for young adults as well.
And we've talked about the impacts of the pandemic and shutting down society on both kids and adults. What does the data show in that regard?
Yeah, I mean, so we really had a big problem before the pandemic, but the pandemic exacerbated things. More social isolation, disruption to daily life, loss of loved ones, and all of those things are linked to the poor mental health of young adults.
Besides social media and COVID, any other big factors that are really impacting this area?
We did find that experiences of racial discrimination, which about 1 in 4 young adults reported, were associated with poor mental health as well.
So what can we do? What can be done to help these kids?
That's a great question. I mean, so unfortunately, we have to be a little reactionary because we're already here. And that means expanding our telehealth services, expanding access to services, but also creating communities, whether it's in education or workplaces, that help our young people thrive, feel connected, and feel like they belong.
And if people want more information or to perhaps see some of your study in the medical journal, where can they go to read more about what you found?
Yeah, I think you can really see the full report of the survey findings at the State Epidemiology Outcomes Workgroup website at ri.gov.
All right, Dr. Sam Rosenthal, thank you so much for being here and for your research on this important topic.
Thanks for having me.